I'm Anna Stromberg. I'm a professor and heart failure nurse, and I'm here with Professor Jaarsma, also a heart failure nurse that has done a lot of research within the field of self-care in heart failure. And I would like to take the opportunity to ask you a little bit about what is self-care?
Yeah, a very important question. What is self-care? I just start with like the proper definition. Self-care are all the activities that people themselves or with someone else undertake to feel better, to promote their health, their well-being, and their quality of life. So it's really what a person or a patient can do, him or herself, in their health.
And why is it so important in heart failure? And what kind of self-care is important in heart failure?
Well, like we know, self-care it's a chronic disease, so people will probably not be cured. So they live their life to have heart failure. And we also know that although we go to the hospital or they go to see a healthcare professional, most of the care people have to do themselves. They're at home taking care of their, for example, taking the medication, eating healthy, watching signs and symptoms. When should I call a healthcare professional? That's what patients all have to do themselves, together or with a family member or with someone else. But so therefore it is so important that patients and well, a lot of other people do self-care. So they really keep the control of their lives themselves.
And what is most important? What's the most important self-care when you have heart failure?
Yeah, well, it's difficult to pick, but there is a lot of self-care that people have to do, and of course, heart failure patients themselves know very well. It's a lot of things you have to take care of. So we often say there is three important components. So it's the maintenance. So how do I keep stable? Taking medication, doing exercise, taking a vaccination. So that is to be stable. A second component then is monitoring. So what's happening with my body? Do I have more fluid maybe in my body? I weigh myself, I see I have more fluid in my body, something I have to do. I have side effects of medication. So that's the monitoring. So being stable, monitor. And the third, what to do. If I have symptoms, what should I do? Should I call a healthcare professional? Should I maybe change my medication? Should I take it easy for a day? So these three components are very important. And it's very difficult then to say, oh, well, this is the most important. And for one patient, it might be super important that he weighs himself every day and checks the fluid. While for another patient, it might be very important to exercise more. So it's important. Everything's important, but what's the most important is difficult to say.
And that's maybe something also that you get a recommendation from your healthcare provider, or you decide together what's most important in your condition.
Yes, yes.
So can everyone do self-care? Can everyone manage?
I would say yes, but maybe someone will call me and said, no, this person cannot do self-care. But we all do self-care. You and I, we brush our teeth, we try to be healthy, eat healthy. So actually everybody, I think, in the world does self-care. But for people with a chronic disease, it's even more important because they struggle more to be stable, not to be hospitalized, not to feel bad. So everybody can do self-care. Some people need a little bit more help, need a little bit more support. But I think everybody, does self-care.
So what kind of support do patients need, or what kind of support can healthcare professionals provide for self-care?
Yeah, I think very important is that people are motivated. So there a lot of support often goes also in motivating patients, but telling people, why is this so important? Why is it important to focus on your symptoms and to call me in time if you have symptoms? So in that case, it's information, it's motivation, and important that people sometimes need to support to make a decision. Because you can weigh yourself and you can say, I have more weight, but then what to do? Should I take extra diuretics or not? So there patients often need more support to make that decision what to do. And that support can come from a healthcare professional. It can come from a partner or a child or maybe a neighbor. So it's not only healthcare professionals that can support in self-care.
Thank you very much for this discussion.
You're welcome.